Very good morning, ladies and gentlemen, and captains of the industry, the healthcare leaders. Some of them will be joining later on, as you can see that the momentum of healthcare is going on. I must first acknowledge that he has come all the way from Nepal over here to participate in the program. He's sitting right in the left row. So very grand welcome to you, sir. So you know the problems with India on healthcare aspect is quite acute. Although I'm trying to give a very rosy picture of what has been happening there, because we should not be a pessimist, we should be optimist. And I believe in one thing, that let us not find problems, let us find solutions. So many people will come and ask for problems, they will not tell the solution. So who are going to give the solution? It is us only. We will have to put pressure and try to get the things organized. And the way we do it, we must also approach a coherent and a strategic approach to deal with those problems, which will actually lead to the practical solutions which is ahead of us. Now often there are smaller issues which are lost in the actually headlines. So many people who turn on the paper or the TV sets, they find out the headlines making all this, but we never try to go deep into that one. So I am here to find out what are those contents that make the headlines. It is not the headlines which is going into the content. So the contents and the kind of approach that we make will actually make the headlines. I am sorry to state that most of the media channel and many of my colleagues in the industry do find sensational news and try to give a different picture, and these pictures are not very true actually often, because they are often biased and they are not independent. And if we get lost on those news and those actually news which do not carry any weightage, then we will not be able to find out the real issues which we are facing actually. The real issues are about a patient-centric approach. Real issues are about affordability. The real issues about making healthcare accessible to the rural India. 73.4% of Indian population live in villages actually. We have been talking a lot about doing activities and making them actually aware of the programs, but still it is not getting through. The doctor-patient ratio as we talk now is 1 into 1,540. This means in every 1,600 doctors, patients, there is going to be one doctor. So this needs to stop. And I must compliment the government, the Narendra Modi's government, what has done it, that they are giving a lot of importance on this aspect. And we are in the verge of building around 18 to 20 new medical colleges, which will actually produce more number of doctors. COVID-19 pandemic has given us an opportunity in crisis. I see COVID-19 pandemic, what had happened to us, which entire world and the healthcare fraternity made a standstill. They couldn't do anything, but this has actually learned us how to cope up with the challenges. This is about trying to find out the solution, and we did so actually. The first and the second wave actually went on, that time actually we were completely blank. And then when we came to know about it, we completely controlled it. So this shows our resilience. So this shows our advantages of making things progress and how we can do things much in difficult times. Imagine Dr. Krishna will be here in the afternoon, he couldn't make it now. So when I was speaking to him, when he made Covaxin, for all of you as you know, to make any molecule, forget about injectables actually, making any molecules, it takes around 10 to 12 years actually of research. It passes through various investigations, various stages. And Adar Punavala and Krishna have thought of bringing the indigenous medicine. Of course, the celebration today is coming from Master Idea, it's a technology transfer. The first indigenous COVID vaccine came from Dr. Krishna Illa, who has been talking to us many times actually. And when I spoke to him that how to do it in 2 years' time, it takes 8 to 10 hours time. Then he told me that actually I have lost 100 years of my life and we have developed it finally and everybody have got benefited out of it. So we need more of Dr. Krishna Ilyas, we need more of other Punavala to come forward. But the real problem lies in India is about how the patients actually get benefited from the hospital. I feel that when they go to the hospital, they first take into admission rather than going through the billing process, which is actually very cumbersome. So I here appeal to all the hospitals and all the owners actually, give them a time, because I know nothing comes free and you need to take actually consideration a lot of a cost burden. A hospital to run, you have to pay the doctors, nurses, paramedicals, the equipment, diagnosis, so many things are there. But you must also be compassionate while giving the healthcare services to them. Because if the moment you give those healthcare services to those needy patients, this will actually change the scenario actually. that will be the game-changing for moment for India, and healthcare transformation in India will come out full-fledged and will make India proud. So this is the area which we must look into it. And second area is about the healthcare insurance. So as of now, actually, when we talked about this, 14 crores people, Indian population, have been benefited from the PM Ayushman Yojana actually. If you look at the current figure actually, 67% of Indian population, they spend out of the pocket. They do not have insurance actually. When you look at the West and other countries, they have the universal healthcare programs where the patient gets easy access to hospitals, they get it. So this is a real crisis which we are facing and we must address it. And some of the healthcare engineers who are present here will agree with me that in terms of quality and in terms of our quality of medicine, the way we make it, we are number one actually. Even we are much more stringent than US FDA, UK, MHRA and all those international statutory guidelines. So we make things better, we do a correct way, our facilities are world class, and US FDA should not pinpoint figure at you that the clean room technology is not being taken care of it so that they will blacklist you. When you go to US and European countries, you will find the factories, you will find the facilities actually not that strong as India. So India is proud of having those plants, and as by my knowledge, there are 747 US FDA plants here in India producing medicines and generics which are supplied to the worldwide. India has truly come out and India has arrived. It is time that we take the momentum ahead and make healthcare accessible and make healthcare reach to the common people. That is what transform India. That is what is going to make healthcare a much more needed benefit what the people are looking for. With this, I conclude my presentation. Thank you very much for listening to it. Thank you very much.